Bismillahirrahmanirrahim. Today, the topic of my presentation is assessment of nutritional status, and I'm presenting it under supervision of my professor, Dr. Sarah Afzal. Quote of the day: whoever follows a path in the pursuit of knowledge, Allah will make a path to Jannah easy for him. Learning outlines: introduction, assessment methods, which are further divided into direct and indirect, then anthropometric methods, biochemical laboratory methods, clinical methods, data evaluation methods, and recent advances in MCQs in there. Learning outcomes. By the end of this presentation, participants will be able to describe the introduction, assessment method, anthropometric methods, biochemical laboratory methods, clinical methods, data evaluation method. Introduction. The nutritional status of an individual is often the result of many interrelated factors. It is influenced by food intake, quantity, quality, and physical health. The spectrum of nutritional status spread from obesity to severe malnutrition. Nutritional status of community is the sum of nutritional status of the individuals. So, to define the nutritional problem of the targeted population, it is necessary to measure its nutritional status. So, nutritional status assessments enable to determine whether the individual is well-nourished or undernourished. So, assessment of the nutritional situation in target population leads to analysis of the causes of the problem. So, the action based on the analysis and available resources would take place. An ideal nutritional status occurs when the supply of nutrient conforms to the nutritional requirements or needs. That is the balance between the nutrients intake and requirements. Diets are weighted in quality according to the balance of nutrients they provide and not solely on the type of food eaten or the amount of caloric intake. So people can have an optimal nutritional status or they can be under or malnourished. So this is a picture of severely underweight or undernourished child. This is the picture of normal healthy baby. And this is the picture showing the morbid obesity of a child. Objective of nutritional assessment: to obtain precise information on the prevalence and geographic distribution of nutritional problems of a given community, to identify individuals or population groups at risk of becoming malnourished, identify individuals or population groups who are malnourished, to develop healthcare programs that meet the community needs which are defined by the assessment, and to measure the effectiveness of the nutritional programs and intervention once initiated. Assessment methods. These are two types of method, direct and indirect. The direct methods deal with the individual and measure objective criteria, while indirect methods use community health indices that reflect nutritional influences. Direct method. These are summarized as ABCD, as A stands for anthropometric methods, B for biochemical laboratory methods, then comes clinical methods and dietary evaluation methods. Indirect methods, it includes three categories: ecological variables including crop production, economic factors, for example, per capita income, population density, and social habitats; vital health statistics like particularly infant and under 5 mortality and fertility index. So these all are, they all serve as indirect methods of nutritional assessment. Direct method of nutritional assessment. First comes clinical assessment. It is an essential feature of all nutritional surveys. It is the simplest and most practical method of asserting the nutritional status of a group of individuals. It utilizes a number of physical signs which could be specific and non-specific that are known to be associated with malnutrition and deficiency of vitamins and micronutrients. WHO expert committee classified signs used in nutritional surveys into three categories. That is not related to nutrition, for example, pterygium, alopecia, pyogenes. Then the second category is that they need further investigation, for example, macular pigmentation, corneal vascularization, geographic term. And third is known to be of value. For example, angular stomatitis, bite or spores, calf tenderness, absence of knee or ankle jerks, enlargement of thyroid gland. These specifically related to the different deficiencies. As in, we can see that in vitamins A deficiency, the very prodromal sign is Bitot spot, which is also called xerophthalmia. In beriberi or vitamin B deficiency, the most significant feature is absence of reflexes, that is knee jerk and reflex. Then comes vitamin D B2 deficiency, in which we get angular stomatitis. This is a very important feature. And for vitamin B3 deficiency, we have signs of dermatitis, diarrhea, dementia. And in vitamin C deficiency or scurvy, this is the typical picture showing these swollen gums. And in vitamin D deficiency or rickets, we have typical picture of bored legs, prominent forehead, and prominent ribs. And these are the pictures showing protein energy malnutrition. This is a picture of marasmus in kwashiorkor, and here iodine deficiency leading to enlargement of thyroid gland, that is goiter. And vitamin B12 deficiency, it also has very specific signs of pale skin, weakness, tingling in hand and feet, disturbed vision, mouth ulcer, glossitis, and mood changes. So these all are the specific signs related to the different specific deficiencies. So, clinical assessment. In clinical assessment, good nutritional history should be obtained. General clinical examination with special attention to organs like hair, angles of mouth, gums, nails, skin, eyes, tongue, muscle, bones, and thyroid gland. Detection of relevant signs helps in establishing the nutritional diagnosis. So these are the examples of illness caused by improper nutrient consumption, as too little can lead to protein energy malnutrition, anemia, osteoporosis, xerophthalmia, beriberi, scurvy, rickets, and too much can lead to stroke, cancers, obesity, diabetes mellitus. Advantages of these clinical assessment is that fast and easy to perform, inexpensive, non-invasive. Limitations are that it do not detect early cases, malnutrition cannot quantify on the basis of clinical signs, many deficiencies are unaccompanied by physical signs, and lack of specificity and subjective natural most of the physical signs. Then comes anthropometric methods. Anthropometry is a measurement of body height, weight, and proportions. It is an essential component of clinical examination of infants, children, pregnant women. It is used to evaluate both under and overnutrition. The measured values reflect the current nutritional status and don't differentiate between acute and chronic changes. These include mid-arm circumference, skin fold thickness, head circumference, head-chest ratio, hip-waist ratio, length. A wooden measuring board, also called sliding board, is used for measuring the length of children under 2 years of age to the nearest millimeters. Measuring the child lying down always gives reading greater than the child's actual height by 1 to 2 centimeters. So this is the picture of measuring the length of a baby under 2 years of age. Then comes height. It is measured with the child or adults in the standing position, and it is usually done for the children who are 2 years old or more. Head should be in the Frankfurt position, that is a position where the line passing from the external ear hole to the lower eyelid is parallel to the floor. The shoulder, buttocks, and heel should touch the vertical stand, and he should either a there should be either a stadiometer or portable anthropometry used for measuring, and measurements are recorded to the nearest millimeter. So this is the method in which a height is being measured of a child greater than 2 years of age. Then comes anthropometric weight. A weighing sling, also called Salter scale, is used for measuring the weight of children at 2 years old to the nearest 0.1 kg. In adults and children over 2 years, a beam balance is used and the measurement is also to the nearest 0.1 kg. In both cases, a digital electronic scale can be used if we have one available. So this is the picture showing the measurement of weight of a baby. Then comes head circumference. Measurement of the head along the supraorbital ridge anteriorly and occipital prominence posteriorly, measured using flexible measuring tape around 0.6 centimeter wide, and it is useful in assessing chronic nutritional problems in children at 2 years old, as the brain grows faster during the first 2 years of life. But sluggish brain is more growth of brain is more sluggish after 2 years of age, so head circumference is not useful afterwards. So this is the picture showing that the baby's head circumference is being measured. Converting measurements to indices. An index is a combination of two measurements or one measurement plus the person's age. Weight for age is an index used in growth monitoring for assessing children who may be underweight. We can assess weight for age for all children under 2 years when we carry out community-based nutrition activities every month. Height for age is an index used for assessing stunting, usually using chronic malnutrition in children. Stunted children have poor physical and intellectual performance and lower work output, leading to lower productivity at individual level and poor socioeconomic development at the community level. Body mass index is the weight of a child or individual or adult in kg divided by the height in meters squared. Birth weight is weight of the child at birth and is classified as if there is more than 2.5 kg or 2500 grams, then it is considered as normal birth weight. And if it is 1500 to 2499 grams, then it is considered a low birth weight. And if the weight is less than 1.5 kg or 1500 grams, the baby is considered a very low birth weight. So this is how weight for age is calculated, in which weight of a child over weight of the reference child of the same age multiplied by 100, and weight for height is calculated in which weight of the child over weight of the reference child of the same age multiplied by 100. And these are the indices like weight for age if the cutoff value based, these are the cutoff value based on standard deviation or percentage. If it is less than 2 and more than 3, then it is indicated as moderate underweight. And if weight for age the standard deviation is less than 3, then it is considered as severe underweight. And if it is and if height for age is less than 2 and more than 3, then it is considered moderate acute malnutrition. And if height for age is less than 3 and bilateral pitting edema, then it is considered as severe acute malnutrition. Interpretation of BMI for adults. For adults 20 years older, a BMI is interpreted using standard weight status categories that are same for all ages and for both men and women. If we have BMI below 18.5, then it is considered underweight. If 18.5 to 24.9, then the individuals are considered normal. And if the BMI is 25, in between 25 and 29.9, then the individuals are considered overweight. And if the BMI is 30 or above, then they are considered obese. Anthropometry waist hip ratio. Waist circumference is measured at the level of the umbilicus to the nearest 0.5 centimeter. The subject stands erect with relaxed abdominal muscles. The measurement should be taken at the end of a normal expiration, and it predicts mortality better than any other anthropometric measurements. Waist circumference. It predicts mortality better than any other anthropometric measurement. In level 1, there is a maximum acceptable waist circumference irrespective of adult age, and there should be no further weight gain, in which the cutoff value for male is greater than 94 centimeter and for female greater than 80 centimeter. Level 2, it denotes obesity and requires weight management to reduce the risk of type 2 diabetes. So the level 2 cutoff value for males is greater than 1 or 2 centimeter, and for females it is greater than 88 centimeter. Hip circumference. Hip circumference measured at the point of greatest circumference around hip and buttocks to the nearest 0.5 centimeter, and the subject should be in standing position. Both measurements should be taken with a flexible, non-stretchable tape in close contact with the skin. Interpretation of waist to hip ratio. High risk is if there is waist hip ratio greater than 0.80 for females and greater than 0.95 for males. That is, waist measurement greater than 80% of hip measurement for women and greater than 95% for men indicates central obesity and is considered high risk for diabetes and serious disorders. And a waist hip ratio below these cutoff values is considered low risk. So there are two major sources of anthropometric information. We can get through demographic and health surveys, multiple indicator cluster surveys, and four main data collection methodologies that provide these information are repeated surveys, growth monitoring, sentinel site surveillance, and school census data. Advantages of anthropometry. Objective with high specificity and sensitivity, measures many variables of nutritional signal like height, weight, mid-arm circumference. Readings are numerical and gradable on standard board charts. Readings are reproducible, non-expensive, and need minimal training. Limitations are inter-observer errors in measurement, limited nutritional diagnosis, problems with reference standards, and arbitrary statistical cutoff levels for what considered as abnormal values. Dietary assessment. Nutritional intake of human is assessed by 5 different methods. These are 24-hour dietary recall, food frequency questionnaire, dietary history since early life, food dairy technique, and observed food consumption. 24 hours dietary recall. In this, a trained interviewer asks the subject to recall all food and drink taken in the previous 24 hours. It is quick, easy, and depends on short-term memory, but not be truly representative of the person's usual intake. Then comes food frequency questionnaire. In this method, the subject is given to the list of around 100 food items to indicate his or her intake per day, per week, and per month. It is inexpensive, more representative, and easy to use. Limitations are long questionnaire, errors with estimating serving size, needs updating with new commercial food products to keep pace with changing dietary habits. So this is a picture of food frequency questionnaire. Then comes diet history. The diet history aims to discover the usual food intake pattern of individual over a relatively long period of time. It is an interview method composed of two parts. First part establishes the overall eating pattern, includes a 24-hour recall about his intake, and the subjects are asked to estimate portion sizes in household measures with the aid of standard spoons and cups. Then the second part is known as the cross check, which is a detailed list of food that are checked with the subject. The diet history has advantages over other methods in that it estimates nutrient intakes over a long period of time, and the disadvantages are that takes about 1 hour of careful questioning, and the interviewer must be a nutritionist or dietitian experiencing in obtaining diet histories. And the most common fault of an inexperienced interviewer is probably that of suggesting answers. Then comes food diary. Food intake, like types and amount, should be recorded by the subject at the time of consumption. The length of the collection period range between 1 to 7 days, and it is reliable but difficult to maintain. Then comes observed food consumption. The most unused method in clinical practice, but it is recommended for research purposes. The meal eaten by the individual is weighted and contents are exactly calculated, and this method is characterized by having a high degree of accuracy but expensive and needs time and effort. So this method is recommended for only research purpose. Then comes interpretation of dietary data. Qualitative method, using the food pyramid and the basic food groups method, different nutrients are classified into 5 groups, and it determines the number of servings from each group and compared with minimum requirements. Quantitative method, the amount of energy and specific nutrients in each consumed can be calculated using food consumption tables and then compared with recommended daily intake. Initial laboratory assessment. Hemoglobin estimation is the most important test and useful index of the overall state of nutrition. Beside anemia, it also tells about protein and trace element nutrition, stool examination for the presence of over-intestinal parasites, and urine dipstick and microscopy for albumin, sugar, and blood. Specific lab test. Measurement of individual nutrients in body fluids like serum, retinol, serum iron, urinary iron, vitamin D, detection of abnormal amount of metabolites in the urine, and analysis of hair, nails, and skin for micronutrients. The advantages of the biochemical methods are useful in detecting early changes in body metabolism and nutrition before the appearance of overt clinical signs, precise, accurate, reproducible, and useful to validate data obtained from dietary methods, comparing salt intake with 24-hour urinary excretion. Limitations are time consuming, expensive, cannot be applied on large scale, needs trained personnel and facilities. Now, moving on to recent advances. According to the UNICEF stat, these are the 3 phases of malnutrition 2021. The stunting, 140, there are 149 children who are under 5 years of age and are affected by stunting, that is too short for their age. And 45 million children under 5 years are affected by wasting, that is they are too thin for their height. And 39 million children under 5 are affected by overweight. So this is the graph showing the trends of stunting, wasting, and underweight from 2000 we can see that stunting has declined very significantly since 2020, but faster progress is needed to reach a 2030 target. But unfortunately, wasting persists at alarming rates, and overweight will require a reversal trajectory if the 2030 target is to be achieved. Dietary assessment methods in epidemiological studies. Dietary intake can be assessed by subjective report and objective observations, and subjective assessment is possible using open-ended surveys such as dietary recalls, records, and food frequency questionnaires. So these are the different dietary assessment methods like a food consumption record, 24-hour dietary recall, dietary record history, and food frequency questionnaires along with their strength and limitation. This is in another article. It is a systematic review on validity of dietary assessment methods to accurately measure energy intake in children and adolescents who are overweight or obese. According to it, its main aim was to determine the validity of dietary assessment methods to measure energy intake in children and adolescents who are classified as overweight or obese. And according to it, findings of this review suggest that a 24-hour dietary recall and diet history interview were the most accurate method at the group level for children aged 4 to 14 years of age, where the parent of combined child and parents were the reporters. This is another review on anthropometric indices and measures to assess change in nutritional status of a population. According to it, a number of measures and indices such as weight for a height, biceps, skin, fold, and mid upper arm circumference perform well in the detection of short-term changes in the nutritional situation of a population. However, height, length for age corresponded for the most to long-term change, and mid upper arm circumference is the best measure to detect short-term changes in the nutritional status of our population. Now coming on to MCQs. MCQ number 1. Nutritional status of the community is the sum of the nutritional status of the individuals. Indirect method of nutritional assessment is anthropometric methods, biochemical laboratory methods, ecological variables, dietary evaluation methods, clinical methods.
C.
Yes, C is the right option. This is the indirect method, while rest are direct methods. MCQ number 2. A 35-year-old woman presents to clinic today for a yearly physical examination. His weight is 90 kg and his height is 1.77 meters. She gave history of no exercise on most days. Her BMI is 20.1, 24.2, 28.7, 30.2, 32.4. It requires a little calculation. The right option is C, that is 28.7. In this, we will keep height over weight, weight over height, weight in kg and over height in meters. We'll take its square, and the answer we get is 28.7. That is, she is overweight. MCQ number 3. The simplest and most practical method of ascertaining the nutritional status of a group of individuals is anthropometric methods, biochemical laboratory methods, ecological variables, dietary evaluation methods, clinical methods.
Alpha. Anthropometric methods.
No.
Delta.
No,
Alpha.
no. The right option is A, clinical method, because it is the most practical method being used for assessing the nutritional status of a group of individuals. MCQ number 4. A 2-year-old child presented in the OPD with complaints of muscle weakness, bored legs, large forehead, abdomen for last 1 month. These symptoms may be a result of which of the following deficiency? Vitamin A, vitamin D, K, vitamin C, or vitamin E?
Beta. Vitamin D deficiency.
Yes, D is the right option. MCQ number 5. Stunting is the impaired growth and development that children experience from poor nutrition, repeated infection, inadequate psychosocial stimulation. Anthropometric index used for assessing the stunting is weight for height for age, BMI for age.
B.
C is
Beta.
the right option. Here, height or length for age is used for assessing stunting. MCQ number 6. A 45-year-old man presents to clinic today for a yearly physical examination. His weight is 75 kg and his height is 1.8. His BMI is 23.15. And it is interpreted as thin, overweight, normal weight, obese, morbidly obese.
Beta. Overweight.
No, he is normal weight, as we can see. That he is falling in this category 18.6 to 24.9 because his BMI is 23.15, so he is a healthy individual. MCQ number 7. A 45-year-old female presents to clinic today for a yearly physical examination. Her weight is 90 kg, height is 1.77, BMI is 28. She also gave history of diabetes mellitus and ischemic heart disease for last 5 years. During her physical examination, dash will be the most probable cutoff value for her waist circumference. 70 centimeters, 75, 78, 80, or 88 centimeters.
E.
E is the right option, 88 centimeter, because she is falling in level 2. If you remember that slide of waist hip ratio, in which if a person is obese and requires weight management to reduce risk of type 2 diabetes or serious complications, then the cutoff value for females is greater than 88 centimeter rather than 80 centimeter, which is for level 1, that is normal for normal individuals. MCQ number 8. A 45-year male patient requiring a bowel resection due to mesenteric artery thrombosis 3 years ago complains of weakness and has symptoms consistent with peripheral neuropathy. He is also found to be anemic on laboratory assessment. Which of the following nutrients most likely responsible for his symptoms? Vitamin A, vitamin B, vitamin C, vitamin B12, vitamin B6.
Delta.
Yes,
Delta.
it shows a deficiency of B12. MCQ number 9. Nutritional intake of human is also assessed by dietary methods. Dash method of dietary assessment is most unused method in clinical practice but is recommended for research purpose only. 24-hour dietary recall, food frequency questionnaire, observe food consumption, food diary technique, and E, dietary history.
Delta.
No, B is the right option.
C.
Sorry, C, observe food consumption. Because it is not practically used, it is just recommended for research purpose. MCQ number 10. What is the primary method of dietary assessment used in epidemiological studies? 24 hours dietary recall, food frequency questionnaire, observe food consumption, food diary technique, dietary history.
Alpha.
Alpha.
No. B is the right option. Primary method used in epidemiological studies is use of food frequency questionnaire. This is the key of MCQs. Thank you.
Thank you very much, Dr. Meha. Very nice presentation. There are two important things that I want to add. One is that